So what happens at the end of the day? The post-clinical conference. Have an agenda or specific items to discuss. The post-conference is most often a time to discuss and reflect on the specifics of the clinical day. You can have an agenda. The agenda can be free-flowing, with an opportunity for students to share their patient assessments, their patient care that they rendered during the day, and any new experiences or something new that they learned. This then is your agenda for post-conference. If you want everyone to share their experiences, though, you'll need to put a time limit for each student so that everyone can talk and you can still finish on time. Remember that this is a part of trust, so that students understand what time the clinical day will be over. If the clinical day is somewhat flexible, then letting students know that ahead of time will really help with their trust in you and the process, as well as their engagement in the post-conference. Otherwise, they'll be constantly looking at the clock, wondering when they're going to be released. During the conference, you can help the students tie their observations and experiences to the evidence, or can they? Or can they tie it to their didactic? Some instructors ask students to give a presentation during the post-conference, such as a brief overview of a patient care scenario or condition. It can be presented as a care plan or a concept map. During this time, the students can work on their critical thinking and their clinical reasoning. The conference gives you an opportunity to work with the entire group as they work through the appropriate care for a patient. I would like you to watch Carol Thorne as she conferences with her students. Generally, a post-conference doesn't last any longer than 1 hour. Not every clinical day needs to have a lengthy post-conference, and that's your call, depending on the clinical rotation. However, I think it's very helpful to gather the students together so that you know that they're all off the unit, and you really don't want to leave anyone behind because you will be leaving the building. Secondly, it's usually nice to have a quick wrap-up. You can give the students guidance on what they might be looking for in the next clinical day. You can make sure you remind them of your expectations for their post-clinical assignments, their reflective journaling assignment as an example. I've also attached a handout that was created by Dr. Marilyn Orman that includes additional post-conference ideas. You can talk with your mentor, find out what is the usual format of a post-conference used by your mentor. In the next video, you'll see Carol Thorne conferencing with her students. This clip comes from Dr. Benner's website, Educating Nurses, and I have her permission to use it. This video is a great example of how the clinical instructor demonstrates the use of leading or scaffolding type questions with students to help them with their clinical reasoning and thinking. It can be very free-flowing, and sometimes I know when I've used it, you can get a little stumped as to what you might ask next. And I think you can see Carol doing this when she's trying to think about what the next question should be so that she can get the students to come to the next step and to make it to the conclusion. She's looking for the clinical reasoning. You can have a lot of fun with this strategy. So next, I'd like you to listen in on her post-conference with her students.